Welcome to Medically Speaking. My guest today is Dr. Richard Charles, the Chief Medical Officer, General Physicians, PC. Dr. Charles, thanks for joining us today.
Thank you for inviting me. Look forward to talking with you this morning.
So if we can, for the viewers who are watching, can you give a brief explanation of General Physicians, PC? I know people are familiar with, say, UBMD or maybe the Buffalo Medical Group, but explain for the viewers, what is General Physicians, PC?
Sure. General Physicians, PC is a multi-specialty group that was initially established in 2010 and has rapidly grown to be one of the largest and most well-respected multi-subspecialty practices in Western New York. We're a collective of over 270 providers, 20 specialties, 73 practices, and 45 or more locations. And our focus is really, as part of the Great Lakes Integrated Network, to be patient-centered providers that are really looking out for our individual patients in a compassionate, collaborative, and convenient way, utilizing the power of an integrated network that includes Kaleida Health, ECMC, and some of our affiliates at UBMD, with a real goal of giving patients an experience that's not only best in class, but also leverages the many resources that are available within the integrated network.
So let's start with the phrase patient-centered. I think that's an important topic for people to learn more about. Easier said than done, I'm sure, but what does that really mean? So you're the provider, I'm the patient. When you say we want a patient-centered approach to my healthcare, what does that mean for the average person?
Well, I think what's really important is these days, patients really want to have care where they want to receive care. So in offices or virtually, they want to be able to have care when they want it, when it's convenient for them, in a location that's convenient, and also get excellent patient care. And I think what's super important about that is that we be available for our patients to provide them guidance, care, help arrange diagnostic testing, referrals within our integrated network so that we can really meet their needs and help them maintain the health that they want to achieve and help maintain the overall health of the community.
So that group that you talked about, so 270 providers, 20 plus locations, and bring them all together over the last, say, 5 to 7 years. That's all by design to help meet the consumer or the patient where they are?
Absolutely. And I think, what you see within our group is the opportunity to utilize, if you're a primary care physician, as I am, to utilize the available specialists, many whom are in our individual offices, so you can have a relationship to talk about a patient's needs and to talk about what referrals they might need. And also, once you've established what the needs are, if they have a test or if they have a diagnostic image that needs to be done, you can leverage the power of an integrated network to arrange those tests, to make it at a convenient place and time for the patient, because there's a lot of different options, but also to provide them a level of care that's really extraordinary within the community. And I think then the follow-up, we are able to share information about the patient with each other as a specialist and primary care provider, but also to get that information to our patients directly. Many people now want to communicate by the internet, by video, such as you and I are doing. And we really try to provide those availabilities and those accesses to care, because really the patient really is the one who's in charge of their health and in charge of their care. And the more that you engage with them, the more that you are actively involved in the choices they make around their care and around where they receive their care, often the better the patient feels about the interaction, and clearly the better the care is. To feel the power of the Great Lakes Integrated Network, what we can offer patients, frankly, in my 25 years of practice, it's just is by far the most exciting time to be a practicing physician, based on all the access to services, specialists, sites of service. Many of our providers do their procedures right within our affiliate hospitals at Kaleida Health and ECMC. They do their surgeries. They see the patients in the hospital. We have excellent relationships with the hospitalist teams that take care of our patients in the facilities. So it really allows for a seamless approach to care.
So you talk about the specialties or subspecialties. Can you talk a little bit about that? What are they and why are they important as part of that, overall offering for general physicians?
Right. And I think it starts from your primary care team, right? So your quarterback, so to say. But we have many subspecialties. We have a very extensive cardiology program through Great Lakes Cardiology. We have a cancer care, associated with both medical and surgical oncology. We have excellent general and colorectal surgical care. We have gastroenterology and ability to arrange colonoscopies and have programs set up so that we make sure that people receive their colonoscopies at appropriate intervals. We have women's health, very extensive, both for those expecting and those needing routine care. We have pulmonary orthopedics, really trying to link everything together. The other really important thing about the specialties is we have a unique ability to get patients more rapid access to specialties than you might have if you weren't involved in a multi-specialty group. And for those services we don't have at general physician, we work very hard to work with our partners within the health systems and in the university to provide the needed care for these patients in a way that meets their needs at the time that their needs are present.
That's great to hear. So I know that you said there's lots of exciting news. I know that you guys have had new buildings open up, you've taken on new specialties, but if you can, share some of those proud accomplishments that you guys have had recently.
No question that the growth of our organization, where we have more primary care providers, more specialties, more opportunity, brand new buildings, north and south, that's all very exciting. I think one of the most exciting things we've done is to really help with arranging access to care. Referral management is another way that this can be described. But what it really is allowing the patient to feel the power of being a patient receiving care in an integrated network. We have a team that when your provider decides that you need a specialty referral, say you need a stress test or you need a colonoscopy, we have a team that will not only say, Mike, you need a colonoscopy, but they'll go and talk to the team that provides that and say, Mike, we have these opportunities in these locations with the best providers. And, we look at quality, and what we do is we try to arrange that. So this idea that we can take the power of an integrated network and take the power of a multi-specialty group. And if you're in your primary care office and you need a referral, if you need to have a CAT scan or an MRI or an echocardiogram, these diagnostic tests, we will help you arrange that. And I think in my practice, it's always been difficult to get people the care they need, to make sure that they follow up and make sure that they get high quality care. This program, this access referral management, as we call it really has been a game changer. And patient satisfaction has been outstanding because, frankly, it's a service that's not readily available elsewhere in the community. And our organization has piloted this, and now it's being moved across the system. And it's really grown organically. And, the ability to service patients has been extraordinary. And, the positive comments we get about how easy it is to navigate through an integrated network like ours, because it can be very complex to get healthcare. It can be very overwhelming. And I think what our goal is to make this very user-friendly. These days people are used to shopping on Amazon, and we want to make it very seamless. We want to have the patient be in charge. We want the provider to give great recommendations within the integrated network, starting within general physician, and really get patients what they need, which is the care where, when, and how they want to receive it.
You can't say it any better than that, Doc. We can feel your passion when you talk about your patients and those that are under the general physician's umbrella, truly transforming healthcare here in Western New York. Appreciate all that you guys do. And thanks for joining us today here on Medically Speaking.
Thanks, Mike, for offering to do this with me. It means a lot to me.